My name is Karen Kruger, and I'm currently the Director of the Motion Analysis Center at Shriners Children's in Chicago, and I'm a Research Assistant Professor at Marquette University in Milwaukee, Wisconsin. So I was an athlete in high school and college. I ran cross country and did Nordic skiing. So went through several injuries and physical therapy, which I feel like I hear that story a lot. So I ended up getting the opportunity to work in the lab of Dr. Tammy Hout Donahue, who was doing work on the knee joint meniscus, and really found my passion for working in the orthopedics field. So that brought me to doing my PhD at the University of Iowa because I had an interest in doing computational modeling in total joint replacements. So I worked with Dr. Tom Brown there and really was inspired with his long legacy of research there. But then for my postdoc training, I really wanted to see some more of the human data collection side of things after spending 5 years of doing only computational modeling. So I did a postdoctoral fellowship with Dr. Jerry Harris at Marquette University, working with Shriners Children's motion analysis lab, where we actually got to work with the patients and do the computerized gait analysis with them, which is what led me to my current role, which I'm really in love with right now. So I've got a couple of really exciting projects that are collaborations between the biomedical engineering department at Marquette and Shriners Children's Motion Analysis Center. One of them, I'm looking at a biplane fluoroscopy model of foot and ankle bones. We utilize biplane fluoroscopy, which is like the moving x-ray of foot and ankle, because a lot of the techniques we use in motion analysis aren't accurate enough to capture the severe deformities we see in a lot of the kids we treat. So we're really hoping to develop this technology to really be able to understand what some of these bone deformities do and ultimately help the orthopedic surgeons who are treating them. And I've been working with some really awesome collaborators at the University of Utah and Dr. Amy Lentz's team on that project. The other area we've gotten into a lot is machine learning, and specifically utilizing all of the motion analysis data that we've collected over the course of a decade or more in our motion analysis center, along with several other Shriners facilities throughout the country, to try and develop machine learning algorithms to determine which combinations of surgical procedures and gait parameters really lead to the best outcomes in the kids our surgeons see. So I've really gotten a lot of support from the ORS in being able to network, both with upper level mentors to give me guidance in my career, but also a lot of peer mentorship. I've really made some lifelong friends with people who I would consider my peer group at the ORS meeting, who I've now seen probably for the better part of a decade, year in and year out. And I'm really fortunate to have developed those relationships specifically because of the ORS. And I think the biggest benefit I've had from the ORS is being able to be involved in several of the committees, and I'm on the organizing committee for the Foot and Ankle Research Interest Group. So that's given me more opportunities to network, meet more people, and really learn different areas of research that I might not have in my own little research bubble. I've got 2 small children, so that limits a lot of time, although time with them is definitely fun most of the time. But I do still love to run and get outside and do as many outdoor activities as I can. I grew up on Lake Superior, so I love exploring the Great Lakes region around here and other outdoor areas throughout the country and world as far as I can get. And I've really been loving showing that side of things to my kids too. So when I've got time, that's what we do.